So hello and welcome everyone. Today's webinar is entitled The Chronic Disease and Injury Indicator Framework and Other Chronic Disease Surveillance Products. This webinar is going to provide an introduction and overview to the Public Health Agency of Canada's chronic disease and injury surveillance activities, data, tools, and products. My name is Bill Cowlery. I'll be moderating the webinar. I'm Manager of Programs and Knowledge Exchange at the Chronic Disease Prevention Alliance of Canada, or CDPAC. And many of you are already familiar with CDPAC. We're a network of national organizations sharing a common vision for an integrated system of research, surveillance, policies, and programs for maintaining health and preventing chronic disease in Canada. Our coordinates are listed at the bottom of the slide if you'd like to connect with us, or if you'd like to view materials from past webinars and events. So we have three great presenters today from the Public Health Agency of Canada, and I'll introduce them in just a few moments. But first, on behalf of both CDPAC and the Public Health Agency of Canada, who are our partner in delivery of today's event, I'd like to wish you a very warm welcome and thank you for joining us today. Very pleased to introduce you our presenters today. The first presenter is Marisol Betancourt. She's with the Surveillance and Epidemiology Division at the Public Health Agency. Marisol has a master's in epidemiology from Ottawa University and a degree in family medicine and pediatrics from Ecuador. She has over 15 years experience in both clinical research and over 6 years experience in chronic disease surveillance and population health. Marisol will be providing an overview of the webinar, introducing the surveillance division of the Public Health Agency, as well as the chronic disease and injury indicator framework. Our second presenter is Peter Walsh, Senior Analyst with the Surveillance and Epidemiology Division. Peter has a master's in science and health and human services and has worked for the federal government in the area of infectious and chronic disease surveillance for over 25 years. Peter is currently working on new and innovative ways to develop and disseminate integrated chronic disease surveillance and injury information products for the division. Peter is going to be bringing you through an interactive tour of the Public Health Agency's Chronic Disease Info-Based Data Cubes tool. And finally, we have Joellen Ellison, also with the Surveillance and Epidemiology Division. And Joellen will be introducing you to the Canadian Chronic Disease Surveillance System, including current activities and plans. And without further ado, I will pass it over to you, Marisol.
Okay, good afternoon, everyone, and thank you very much for joining us. Thank you for the introduction. Before we start, I wanted to give you a brief overview of who we are, what we do, and what we presented today. We first give you an introduction of what we do at the Chronic Disease Surveillance. We belong to the Center for Chronic Disease and Prevention branch, and we are the Chronic Disease Surveillance Division. After that, we will talk about the info base and the cubes, the data cubes, followed by the chronic disease and injury indicator framework that I will be presenting. And finally, we will have as the last presenter, Joellen with the Canadian Chronic Disease Surveillance System, presenting an update on this database. This is an important database that we use in our division, and PHAC is the lead on the development of this database. So, as I said, we are the Surveillance and Epidemiology Division, and our mission is to provide timely, relevant information and analysis that drives public health intervention in chronic disease, injury, and the risk and protective factors. And it also covers the lifespan from childhood, infant, maternal health, as well as adults. For many of you, this graph will be somewhat familiar. This is the surveillance cycle, and of course, as a cycle, it continues, is a continuum, but the main focus is, of course, as you can see in brown color, which is the health of Canadians, and that is, of course, the main purpose of all the work we do. Within this surveillance cycle, there's many important pieces that are an integral part of it. And that is, of course, doing data monitoring, data collection, data analysis and interpretation, and making products available for knowledge and dissemination for public health action that, of course, at the end will reflect on the health of Canadians. And the way we do that is by traditional reports, but also by new innovative ways, such as putting out there the most updated and ongoing information for action. And this is, the purpose of this presentation is precisely to present to you two of those products that we have and can offer to you. In blue, you can see the piece that belongs to our group, the Surveillance and Epidemiology Division. We also do a little bit of the green part. We work with partners and stakeholders such as South Canada to develop new data to cover gaps, for example. We also do data analysis and interpretation. As I said, we also make that information available to you. And this graph is to give you an idea of how broad our surveillance goes. In the light colors, you'll see several diseases that we do surveillance, and we keep growing based on priorities that are required to keep the health of the population. And our main components or our groups are not just chronic disease itself, but we also focus on upstream factors such as the behavioral, environmental factors, and that's the team I belong to. We also have other chronic disease conditions and a group that are focused on maternal and infant health as well. You can also see on the side of this graph several databases, and these are pretty much all databases that currently we use to inform our surveillance and our surveillance products. And I wanted to highlight within those the CDPAC data that we will be talking about today, and also the info base. The info base and all these other figures that we see in the bottom are data systems that we have created to facilitate the production of our surveillance products. So we will be talking about the info base today, and within the info base, and this is a screenshot of what you will see within it. We will show you first the chronic disease indicators from Warren there, and below that you can see the data cubes. The connection of all these products is that we all produce information for chronic disease surveillance and for chronic disease prevention, and within this product, for example, you will see that we use PCDFS as a primary data mainly for prevalence and incidence of chronic disease. And with this step, I'm going to pass over Peter, who will talk about the data cubes and will give you an overview demonstration of how the data cubes work and what it pertains. Over to you, Peter.
Thanks, Marisol. I'm just putting up a URL here, folks. If you want to copy it down, that will get you to the website fairly quickly. So it's infobase.phac-aspc.gc.ca. So here's the website, and hopefully everything goes well. We're doing it live right off the website, so cross our fingers. So that URL will take you to this location. And on this page, two of our tools are mentioned, the indicator framework, which Marisol will be talking about a little later. I'm going to be talking about the item on the bottom, the data cubes, the chronic disease info-based data cubes. So to get into the data cube component, you click on this bottom button here, use data cubes. Now, just to give you a little bit of background about what data cubes are, they're like mini online databases that allow you to access a variety of health indicators and manipulate the data and extract the sort of information you want. You can also do some graphics and that sort of thing. I'm going to give you some examples of what you can do with the tool. So I just want to make a mention at the bottom of the data cubes page, there's two green buttons, and basically what these are two ways to access the same information. Just think of it like two different interfaces to access the same thing. One is what we call the legacy interface over here on the right, which was the original Cognos PowerPlay Studio software. And then on the left over here is what we call the accessible interface. And that was built to meet the government requirements for the visually impaired. But to be honest, it's a simpler and friendlier interface if you want to use it instead. Like I say, both access the same information in the background. It's just two different ways of going in, and I'm going to demonstrate both of them for you right now. So the first one I'm going to go into is the legacy interface over here on the right. So once you get in here, at the top of the page, I just want to bring your attention to a few of the links up here. There's a quick user guide. If you click on that, it's just like a cheat sheet for all the different buttons and displays that are inside the PowerPlay Studio tube, what they all do and what they all mean. And then if we go back, there's an online manual, a PDF manual. I'm not going to click on that one. It's bigger and more in-depth. And then over here on the far right are training videos. And the neat thing about these training videos are they're 30-second videos that will run on your laptop or your computer, and you can just kind of sit back. It's like a YouTube video. You can watch them. They only take about 30 seconds. There's about 15 of them. And it's a great way of learning how to use the data cubes and give you some of the knowledge you may need to use some of the more advanced features. Okay, so I'm going to actually get into a data cube here. And again, this is the legacy interface. This was the original interface that came with the software. Each of these folders represents different health indicators that are available to you, a variety of data from mortality, injury, morbidity data, cancer incidence data is in here, risk factor data, promotion, prevention. There's a lot of stuff, potentially a lot of stuff for you to explore. You can search for stuff too. Right up here at the very top in this white search box is you can type in some terms and do a quick search for content as well. I'm going to go into one of the folders down here at the bottom, this one on risk factor data. I'm going to open up a data cube in here. I'm going to pick this one over here called Health Trends Standardized. So this is some data from Statistics Canada on health trends from the Canadian Community Health Survey. And so now we're in a data cube. This is usually how they look whenever you open them up in the legacy interface. Just going to point out a couple of features. So there's usually a graph and usually a table down here at the bottom. They're linked together, so anything you do to the table or the graph affects the other one, and I'll show you how that works in a second. So just to show you what data is inside this data cube, right up here on the far left, you'll see this little thin strip, like a little icon bar over here with a little greater than, or I guess that's, yeah, greater than symbol. If you just click on that, that opens up this third little window on the left, and that basically shows you the variables that are in this data cube. So, for example, if you click on this indicator one, it shows that under the indicators component from the survey data are all these different health indicators. So lots of different stuff, risk factors, and some disease infos in here. And then also we have three genders. I think because it's a health trends data, we have multiple years, so I guess we're up to, what, 8, 9 years now, all the way up to 2013. We have, in this particular cube, we only have the provincial level down to the Canada and the provinces. In another data cube, we actually go down to the health region level. In the health trends version of the data, not the standardized one, but the non-standardized one, it actually goes down to sub-provincial level if you're interested in that. And then the measures in the cube are the standardized rates, some confidence intervals, and some statistical significance information as well. So that's all the stuff that's in this particular cube. You can manipulate this cube across all these different dimensions and, you know, play with it till your heart's content. These 6 dimensions are also up here on the top of this bar at the very top. Same six things are there. So, for example, I open up gender, the sex one, the 3 sexes are there. If I click it here, it's the same thing. 3 sexes are here. So just to show you that they're in both places, you can manipulate the cube from both locations as well. So, for example, if I want to filter in here on the males, I want to change it. Right now, it's just showing both sexes. If I want to change it to males, you can just right-click here and go filter on males, and males are being filtered in the data and in the graphics. That's one way of doing it. You can do it from over here, or I just tend to prefer to hide this side and just manipulate things from this side. So you can also do it from here and go back to both sexes. So as soon as you click on things dynamically change in the cube. Everything in the interface is getting blue in here, down here in the bottom part of the table. It's hot. So for example, I want to focus in on Canada. I just click on Canada. The data drills in, and we're just looking at Canadian data, and the graph automatically adapts to that. You can hit the back arrow and just go back to the original, previous screen. If I just wanted to focus in, let's say, on the 2013 data, I just click on that, and now the graph in the table is only showing 2013 data. So you got a lot of flexibility as to what you can do in the data and what you can do with it. This sort of graph is kind of neat because you can see provincially and Canada-wise, you can see the trends over time for the time elements. You can specifically pick one of the indicators and just drill in on that over here. So, for example, perceived mental health, very good or excellent. I can just click on that, and now we're just looking at only that's being displayed in the table. Just want to show you how you can export some of this information. Say you've been playing around and you want to save this data to your computer or something like that, like the information in the table. Down here on the bottom section are these buttons. Like I said, I won't go into all the different buttons, but suffice it to say that cheat sheet I was mentioning earlier tells you what each one does. So, for example, you can go in and change the graphic to be a variety of different types of styles. If you want to export this table to a spreadsheet, for example, you can just click here on this little page-like one at the bottom and say, I want to export to Excel 2007. So I'll have it automatically open up here. So the data is automatically put into Excel, and all the data is parsed. So you don't have to do any of that work yourself. And what else? You can copy this image if you want to. You just right-click on it, and you go copy to clipboard. And I won't do it, but you can copy the clipboard, and then you can go right in the PowerPoint and paste it in the PowerPoint if you wanted to. So a lot of flexibility. If you can watch some of the videos, you can actually see a lot of what you can do. I'll give you another example. You can manipulate, like you can drag, for example, if I wanted to pull the sexes down and drop it into this underneath the provinces. So you see the difference. If I were to let the gender go right now, it would replace the province line. But if I put it right below it, so it's like this bottom little strip and let go, it puts the genders down below in the table, and so you can kind of drag and drop stuff right here on the screen, and then I can go and I can say, well, I want to see all three sexes. So if you pick the highest level, it'll show all three sexes in the graph now under each of the provinces. So a lot of ability to play with the data dynamically online, which is a nice little hallmark of the legacy interface. So I'm going to stop on the legacy piece, and I'm going to promise you I would show you the other interface. So I'm going to get out, and I'm going to go back to the main interface here, and I'm going to show you the same data, but from the accessible interface. So same database in the back end, we're just going at it using a different interface. So I click on there. It's the same folder structure that we saw on the other interface, and I'm going to go right down here to the risk factor data at the bottom. I'm going to go and find that same health trends data right here again. So we're opening up the same thing. And what this accessible interface does is it steps you through each of those 6 dimensions I showed you in the other view of the tool. So I'm going to the default here is usually the first one, so I'm going to stay with that first one, but you could pick any one of these. And so what it does is it steps you through each of the variables on each screen and lets you pick what it is you want. I'm going to leave both sexes checked off right now. You keep clicking through. This time I'm going to pick all the years. I'm going to select all, and it automatically will now select all the years data. And And then I'm going to select all the provinces too. In this case, just hit the select all. You can select any combination of provinces or whatever you want. And then I'm going to leave it just as the last of the 6 variables was the measure variable. I'm just going to leave it on the age standardized rate. And we're going to go to the table layout. So this gives you full control as to how you want the table to be laid out in this particular interface. So I'm just going to put these first 3 variables on the row and these other 2 in the column, and then just view results. Hopefully it'll work. There we go. So there's the output in a very simplistic kind of table. Again, you have full control on how the table gets laid out. The nice thing about this table is if you want, you can kind of highlight the whole thing. And I'll just grab that. I'll grab that right now. Let's copy it, Control-C that, open up I'll open up Excel just to show you how you can literally copy and paste it right off the table and right into Excel. So, and again, each of the cells is already parsed, so you don't have to extract anything. So it's nice that way. You can quickly extract what you don't want right off this interface. So that's the accessible interface. This whole screen is compliant for the visually impaired. So, you know, you can if you're blind, you literally could tab through each one of these cells, and all the columns and rows would be spoken to you, so that you can understand what you're actually looking at in this table. So that's pretty much it for the accessible interface. I'm going to show you one more thing while I have the chance. I'm going to go back to the legacy interface. In this section, we have an area that's called Interactive Web Reports. And you click on that. And so, for example, there's this interactive mapping tool here that talks about risk factors. There's also one here for diseases. I'm going to click on the risk factors one just to show you what it can do. So this brings up a little pick menu, and if you go in here and you say, I don't know, let's pick obesity because it's a big problem right now, and we go pick both genders, and we pick all age groups. And this last section is the health regions. So if you go in and you decide what health region you want to pick, in this case I'm going to pick all the health regions, so you just have to click the Select All button, and then you go Submit. It hopefully will produce a nice little map that there it is, a map of Canada that shows obesity in the country, and then below it is a table that has the associated coloring, so and percentages. So the map and the table are synced together, and there's a graphic here that shows the color distribution. So you can do this for a variety of diseases and a variety of risk factors. I'm going to show you one more thing too. If you want to zoom in on a particular region, you can. I'm going to deselect all. This time I'm just going to pick the first 4 health regions in this land and submit that. And then so it just lets you zoom in on a particular part of the country if you want, and the stats are dynamically recalculated for the particular region that you're looking at. So that pretty much covers, in a nutshell, in a very quick sort of way. By the way, that was under the Interactive Web Reports section. The data cubes and the 2 interfaces that we currently use for the data cubes. I'm going to pass it back to Marisol, who's going to talk to you about the indicator framework component of the tool.
Thanks, Peter. And this was pretty neat. As you can see, the data cube is a very interactive tool, and it offers you an immense amount of data that you can play with. I will now talk about the chronic disease and injury indicator framework. And one of the main characteristics of this tool is its simplicity. It was built to be simple, easy to use, and that will bring you to the key numbers of chronic disease that you can use to more or less paint a picture of what is going on chronic disease in Canada. The indicators and measures and components of this framework were carefully selected, the consultation and the advice of experts to ensure that measures and values that we are giving you here are key official numbers that can be used for quick references and also to support policy and programs on chronic disease prevention. So what is the chronic disease indicator framework? The chronic disease indicator framework is the first of its kind developed in Canada, and it's a comprehensive resource on key indicators, measures, and statistics of chronic disease and its risk and protective factors in Canada. Why was the framework developed? It was developed to support the agency in its mandate to build evidence and help understand chronic disease trends, risk factors and determinants, and to inform health interventions in healthy living, chronic disease, and injury prevention. But mainly, it was developed to facilitate ongoing, and I will highlight this, also consistent reporting on chronic disease and injury. How was the framework developed? And all I will say for today is that the framework was developed by the agency and was developed in consultation with key stakeholders that include experts, provinces, and territories. For those who are interested on details on how, on further methodology techniques or how this framework was developed, we have published a paper manuscript describing in detail the process followed, and I will give you the link and the journal to this paper at the end of this presentation. But I will briefly walk you through the main steps that were taken to develop this framework. We first gather information, and that entails doing an environmental scan, looking carefully to databases nationally available, and identifying the key databases that are reliable and can give us ongoing information on chronic disease. We also identify emergency health issues and prevention priorities and ensure that those are captured within this framework. And after all of this process, we identify several key measures, many of them, and after that, we took the second step, which is consultation, mainly to help us prioritize those indicators and measures. And finally, there was a validation process. In this step, what I will mainly say is that most of the indicators and measures in the framework are measures already used by other partners, such as PHAC Canada, Health Canada. We did not and we should not reinvent new measures when they are available and validated. However, there were many gaps. One of them, for example, multimorbidity. And during the development of the framework, we did derive multimorbidity measures from survey data. And lastly, our mission, of course, is to make this information available, and that's how we created these two products from the chronic disease indicator framework that we are now presenting to you, and we're very excited to do so. So what is in this framework? There's 41 indicators with key measures incorporated within the 6 domains. The information we will find within are pan-Canadian estimates, time trends, on-the-spot pan-Canadian estimates, data breakdowns, demographic and socioeconomic variables, and all these measures and indicators are aligned with our corporate foundation, which is to address the lifespan from children, youth, to adults and seniors. So what are the current products that we have for you derived from the chronic disease indicator framework? We mainly have produced the chronic disease indicator framework. We call it CDPAC web interface, and this is the product that I will be doing a demo shortly after this presentation. The web interface of the framework is a user-friendly interface that provides access to the framework's content. It uses the same software as the cube, the data cube you just saw presented by Peter, but in a way, it makes the interface much more simple. That is to say, it's not dynamic. Tables are fixed, so you get what you get. And when you need further data or further details, there's other tools available for that. But if you need quick, high-level, relevant information on chronic disease, you're looking for a prevalence of diabetes, you want to know what the official latest number is, or you want a data breakdown by sex, by income quintile, and so on and so forth, you will find that information here, as well as by PTs. The other product we have is the PHAC, and this is a printable two-page PDF form in a table form, and its objective is to give you a summary of what you will find within the framework and therefore within the web interface. And you can see there what the components are, which indicators, which measures, the pan-Canadian numbers, and the database that were used to produce those measures. And you can obtain these quick stats from the website, from the web interface, and print it and put it in your office and have it easily accessible for you to have a brief idea of what is in it, and if you need, then you can go into the tool. What it means for having this tool, what does this mean for the health of Canadians? Mainly to have that data that supports public health priorities, which is readily available for policy and program makers, and also and mainly you have access to consistent and accurate estimates of key measures of chronic disease that could give you an overview of what is happening with chronic disease in Canada. This slide is very similar to the one I presented at the beginning of introducing our surveillance system here at PHAC. But this one is highlighting the databases that the chronic disease indicators network is currently using for reporting on its indicators and measures. And I will highlight the main databases are the survey, CCHS, Canadian Community Health Survey, and the CHMS, Canadian Health Measurement Survey, as well as the CCDFS that I previously mentioned we use to report on prevalence and incidence of chronic disease, and it is our primary database for that. And with this figure, before I get into the demonstration of this product, I wanted to give you an overview of how the framework is structured and how the tool itself is structured. And this is no news. This is kind of the anatomy that is normally somewhat used for frameworks and indicator development. And it starts with the metadata that includes a core domain, and that's a very broad concept. For example, disease prevention practices or health outcomes. And creating this core domain help us capture the main pieces of chronic disease surveillance for chronic disease prevention. And when developing this framework, that was our objective. Within these 6 core domains, there are several indicators, as I said, 41, and an example of an indicator that is a bit more narrow than a core domain, but it's still broad. For example, we talk about disease screening practices such as cancer screening, or we talk about healthy eating. And then once we know the indicator, an indicator could have more than one measure or could have several measures, and the measures themselves are driven somewhat by the database that we're used to report on, but we always try to keep consistency in terms of the population, the age group that is used. For example, for cancer screening, we have the measure will be presented of women for 25 to 69 years who report having a pap smear test at least one in the previous 3 years. And then the data, the numbers that are set into the system and the ones that probably you're looking for. For example, here, 80% of women, 25 to 59 years, report having a PHAC in the last 2 years. And of course, this data is then interpreted for action. 3 in 4 Canadian women are routinely screened for cervical cancer. So these metadata, the care domain and the indicator, they are somewhat the model that was used to present a picture of chronic disease through the chronic disease indicator framework. This slide shows you an example of what kind of information you find within. For example, you can look for healthy weight and look at the prevalence of obesity in children and youth. And then you can make some links, like, for example, what are the other behavioral factors that are driven healthy increase of weight in children and youth? What's the percentage of population that age with healthy eating behaviors, those who are physically active or inactive, smoking, and so on and so forth. So before I go into the demonstration of this tool, I wanted to highlight to you that when you go into this web interface, you have 2 main pieces. One will be a main page, and within that, you will see something you will see a description, several tabs. You will gain access to publications that have been, related publications that have been done based on the framework. You will also have access to all measures, indicators, and pan-Canadian statistics, and the data tool itself. So the data tool will bring you to an environment where you can select tables by data breakdowns, not just pan-Canadian estimates. Here are the links, the key links that could be useful to you, and I wanted to share with you today. The first one is the direct link to the web interface of the chronic disease indicator framework. The second one is a link to a publication of the quick stats. As I mentioned, the quick stats is a 2-page PDF file that gives you a review of what is in the current edition of the framework. By the way, I did forget to mention that our plan is to update this framework annually every fall. So we are currently working on the 2015 edition, and our plan is to publish these quick stats in our journal yearly. So here is the link for the last publication. And lastly, the paper I mentioned to you about that describes the methodology used to derive this framework. This paper will walk you through details of how this framework was developed and validated. And just here at the top of the page, before I forget, I have a hashtag. Please share this hashtag, tweet about us. We are a new product as opposed to the data cube that has been available to you for quite a while. The CDPAC chronic disease indicator framework is a new product. We're very excited to present this to you. And we have put a lot of effort into this. So the more people know about this, the more well spent will be the time and money in developing this product. So to begin with, you start with the same page that Peter showed you when he was demoing the info-based data cube. You will have one button that gives you access to the chronic disease indicator framework, and another one that gives you access to the data cube. And here is the link in the top, as you can see, and I also provided in the presentation. This is the main page, and you have 3 tabs in the top. One is the data cube. These 2 tools are integrated, and the other one is the indicator framework. And when you hover into the indicator framework, you see a few components of this tab. For example, if you click in publications, you will gain access to the related publications, and in the future, the framework is being available to you since May 2014. So we are currently working in new products from the framework, and all those publications will be under this tab. There is a user guide, and there is also direct access to the data tool that gives you more detailed data breakdown. So we go back to the main page. Takes a few seconds. And you also have access to the latest quick stats here, which is, as I mentioned, a summary of what is in the framework. And it's exactly the same table that was published in one of our journals, and that you have the link to this table as well. And please, heads up, next fall you will be able to have this table as well in the same journal. And then below you'll see the list of the 6 main components of the framework. And these ones unfold and show you which indicators and measures are within. It's exactly the same information that you have in the quick stats. It gives you the pan-Canadian estimate, the data source that was used to produce this number, but you also have access in the last column of this table to a description of these measures. For example, let's go to behavioral and protective factors, and we want to know how a description of sedentary behavior, for example, how was this measure developed, how to interpret, which data source, and a little bit further details, numerator, denominator, when it pertains and is relevant. And you can go back to the main page by clicking the arrow on the top, or by clicking main page within this menu again. So this is what I wanted to show you in the main page. There is also, again, our hashtag again, and extra information. And finally, the link to the data tool. Click there. And you probably recognize somewhat this environment, which is the latest version that Peter showed to you of the InfoBase data cube. The difference is that with the framework, you will get to your data in 4 steps. So, for example, if you're interested on behavioral risk and protective factors, or you're interested on physical activity prevalence, it's very apparent where it may be. It's physical activity, it's a behavioral risk and protective factor. So we click here. If you don't know where the measure might be, go back to the main page and look at the measures available in the framework, and then come back to this selection and look for the domain that is relevant to you. Click next level, and let's choose physical activity. Within physical activity, which is the indicator, we have 2 measures. One for children based on measured data, and one for adults based in self-reported data. So we click on physical activity for adults, and these are all the data breakdowns that you can have. You will see that based on which database was used, the ability of us to present data breakdowns will increase or decrease. The CHS, Canadian Community Health Survey data, allows us for much more data breakdowns than, for example, the Canadian Health Measurement Survey. And that's, of course, in a way, a limitation of certain databases. And once you click, for example, in sex, this is the output that you get. You get a heading in the top, which domain, which measure, which indicator, which measure, the population that is included in this group, 20+ years, and here are the rates. The same as with the cubes, you right-click and you can copy and paste in your slides. And you can also download the table in an Excel file, the same as Peter showed you with the info base. And there's also a footnote that tells you about the database that was used, any important information that you need for interpretation, and sometimes they are not when needed. So this is pretty much the tool. After that, if you want to come back to, if you want to select another indicator, just click there. If you want to come back to the main page, go to main page. Or if you want to switch to the cubes, you can do that as well. I'll show you another example quickly, just because I want to highlight something that is relevant for you when using this framework. Let's go to morbidity prevalence, for example, and we use the CCDSS as our primary data. For example, if we want diabetes in adults, you will find two measures: prevalence of diabetes adults administrative data, and prevalence of diabetes adults self-reported. Administrative data refers to pretty much in prevalence and incidence to our CCDSS data, and is our primary, more reliable data for these measures. You go to next level, and these are the data breakdowns we have. So you see that we only have 6 age groups, PTs, and of course trends. Let's click on trends, and with just 4 steps, you can get this nice table with the trends of diabetes for adults 20+, with confidence intervals and a graph. You want to just come back to the selection, just click the arrow in the top and select another group, or if you want to select another indicator, I will select now prevalence of diabetes adults self-reported, just to show you that given that we cannot present you further data breakdowns for other socioeconomic determinants of health using CCDSS administrative data, we are offering to you further data breakdowns using CCHS. So, for example, if you want to know income, then you click here, and here is the information we have. Because the CCDSS is our primary data and our official numbers for prevalence and incidence derived from this database, we are not, you won't find here that information from the CCDSS on sex or from the CCHS on sex, but you'll find the complementary data breakdowns that can assist you in your research for policy if needed. So that's it for my presentation. Please, I'm now going to pass it over to Joellen, who will talk about the CCDSS data. And over to you, Joellen.
Thank you, Marisol. So, hi everyone. My name is Joellen, and I will be presenting to you some information about the CCDSS, stands for the Canadian Chronic Disease Surveillance System. So today, briefly, I'll just go through our goals and objectives of the CCDSS, a brief history, current activities and plans, data sources and operations, caveats, and we love questions, so can't wait for that. So the objectives of the CCDSS is really to enhance capacity for the province and territories and the federal level, create national comparable data. So as Marisol and Peter have mentioned, we're trying to paint a picture of the burden of chronic disease in Canada. We also have delved into dealing with comorbid conditions, and also with this data sources, we're able to talk about health services utilization. So that's people that are able to visit a physician or healthcare provider. The main point of this slide is that this is a collaborative approach. Definitely, we need everyone who's involved. We can't do this alone. We have a partnership with federal, provincial, territorial governments, which is We're a very valued partnership. It is a distributed system, and therefore the linkage, which I'll get into a little bit more, is done at the provincial territorial level. Here at the agency, we're not linking the data. The linkage is done at the provincial territorial level, and then the output data sets, which comprise of the system, are sent to us. This is also built from the National Diabetes Surveillance System. That's how it all started. Again, we're a partnership. The Public Health Agency provides coordination and technical support. We do the reporting, but we're not the only ones. The provinces and territorial ministerial governments report data as well. We're funded through memorandums of agreements with provinces and territories, and provinces and territories through committee work identify and assign technical resources, implement and maintain the system, and actually run SAS macro code that we developed here at the agency, and they create their own regional reports, and that's the capacity building piece. A brief history is that we started out as the National Diabetes Surveillance System, and feasibility and validation work was done, and this is just a short list of those. And then a case algorithm was developed and then for diabetes, and then reported in 2009 in a report from the CCSS, or the NDSS, in 2009. And we basically had other reports that came out. The CCSS expanded to collect information on hypertension, and validation and feasibility studies were published. And we also have a Hypertension in Canada report in 2010. So the CCSS continues to expand. The criteria for planning and expansion are public health importance, relation to conditions already in the CCSS, so comorbidities, data quality, and most importantly, feasibility. A little bit about our governance. The CCSS is guided by the technical and science committees, and these committees are comprised of individuals representing or advising us from each province and territory. This is the PHAC at the agency. It's housed at the Surveillance and Epidemiology Division. We have chronic disease working groups that specialize in each of the diseases that we're collecting, and we get science and technical advice from these groups. So this is a list of where we are today and expanding, and in the gold list here, National Ongoing Support Surveillance Ongoing, these are the diseases that are now being reported ongoing each year through, as Peter and Marisol presented in the data cubes and also the chronic disease indicator frameworks. Agency reports are also being created, and these are in the national pilot and feasibility projects. These are diseases that are still being developed. Case algorithms are being developed in those working groups. A little bit about the technical code piece that the provinces and territories run. We have a phased implementation. Phase 1 is the disease and condition investigated, and phase 2 is then cross-analyzed with complications. So in short, we make sure the incidence and prevalence, the more simpler statistics are correct before we move on to looking at whether a person has more than one disease or complication. So our data sources, the three main data sources, we're expanding out to others, but the health insurance registry, which is housed at the province and territory, hospital data, which is submitted to CIHI, and the physician billing or fee-for-service, and that's where the diagnostic information comes from. So this is just a visual of the three data sources. A linchpin of this linkage is that a deterministic linkage for the unique, and that's the health identifier, that has to be there. The demographic data for like age, sex, and birth date are obtained from the health insurance registry. In the hospital and physician files, whether or not the person basically had the disease status. The death data and information is obtained from the health insurance registry, and whether or not a person has more than one disease or one or more is obtained through the hospital and physician data sources. And then the health services use that I was speaking about earlier, that comes from the hospital and physician files as well. So we couldn't do any of this without the expert works of the province and territories and our CCSS project leads on case rule development. This is just a brief slide of this actually takes a couple of years on average, but the data are run by provinces and territories and compared to the literature. Validation studies are done mainly on, we have provinces like Ontario and Manitoba who actually take these results and see, if someone says there's a diabetes case, they'll actually go back to the charts and check to see if the physician in the record is actually a case. Feasibility studies are looking more about whether the numbers make sense. Then the case definitions are recommended to the scientific committee, and with approval there, it goes on for national pilot, meaning all the provinces and territories run the SAS macro code, and then it moves on to ongoing surveillance, CCSS reporting, and in the data cubes and indicator framework and agency reports, and peer-reviewed journal as well. So once the definitions are validated, an annual summary data are done by age and sex, and aggregated data are sent to the agency for analysis and comparison. So we do data quality checks on the data as well. So the provinces and territories may collect data and store information in different ways, and the software is then utilized by each province and territory so their data are manipulated and summarized. And this is just a picture of, at the province and territorial level, what the data sources may look like, the raw data, and this is the most complicated part, is to get the raw data into the data structure that's needed for the SAS software. These are pre-processed SAS data files, and then it's formatted when the SAS macros are run on the data. It gets formatted into the health insurance registry file, physician service file, hospital file, vital statistics, and drug files. There's an event registry creation, so each disease has its own registry, and these are kept from year to year by the provinces and territories in case there needs to be follow-up. In our case algorithms, there are various techniques that are used to deal with false positives, false negatives. And for instance, if every record is a case, then like in diabetes, the case rule is 2 physician visits in 2 years and 2 hospitalizations, and that every case is a case and it's prevalent for life. So sometimes exit rules can be done or implemented in the case algorithm to mitigate that, say that if a person has diabetes for 15 years or so, then they will be checked to see whether they have the disease or not. This is just an event registry record description. These are all the data elements that are common across the country, and a brief description of each, and a little bit more detail about how the disease registries are linked. A master registry is created, and this is basically how we look at a person who has more than one disease. Event status 1, 2, and 3 are the different diseases that a person may have. So the advantages of a master registry is that it simplifies processing. We try and make the code as fast and simple for the provinces and territories to run. And it permits longitudinal analyses because these registries are kept over time and interactions can be checked. And this is an example of our data dictionary. We provide documentation to the province and territories and anyone else who would like information about what data elements are available and more details of their valid values and even the length of that they take up in the FAST program. There are several nuances about these data that are provincial and territorial health administrative data. These data are not collected specifically for surveillance, even though we do surveillance on them. So kind of a limitation is again, strength in that the system itself is it's flexible and frugal because these data are actually collected for billing. The unique only within province or territory, people with only federal insurance are not. So the people who are included in this database are only those with federal health insurance, those with a valid health number. There could be double counting in the database because people who move, let's say, from Alberta to Saskatchewan, they could be for a time double counted, both in Alberta and Saskatchewan if they move, but those are resolved usually in the next fiscal year. And then some provinces, due to privacy rules, have suppression in their data for the small cell sizes. Also, because these data are billing data, the physicians who are salaried may not what's called shadow bill, which is basically create a record of the visit. So in that case, we would miss the cases that come under the shadow billing. And so that's something that we're aware of as a limitation. There are also some data quality nuances with the Hospital Discharge Abstract Database. Only acute care are complete nationally. Emergency room day surgery are not complete. And there's some nuances with Quebec. And so we keep a log of all the data quality issues and limitations and also the system strength.
Thank you very much, Joellen, and Marisol and Peter as well for those excellent presentations. I've got a question coming in here. One for you, Joellen, just on the CCDSS. Someone's asking, how is the denominator different than Statistics Canada's census or population estimates?
Okay, so the CCSS denominator is a little different than the Statistics Canada population estimates in a couple of ways. One is that the CCSS denominator comprised of individuals with valid health insurance, and it's over a fiscal year, a period of time. So let's say this last fiscal, April 1, 2014 to March 31, 2015. And whereas the Statistics Canada population estimates, that's an estimate and a point of time as October 1 of, let's say, 2014. So it's a little bit different there. So what happens is in that fiscal year of time, the CCSS will include the death of any person who died during that fiscal year. So the CCSS population is a little, denominator is a little bit higher, tends to run a little bit higher than the Statistics Canada population estimates. And we actually are working on a paper to submit to the CBIC journal to explain in more detail of those differences, but that's the biggest difference between the two. Hopefully that answers
Yes, thanks, Rowan. And I just see a note from someone that they're no longer able to hear on the teleconference. So I think we've lost that line. I'm just going to quickly dive back into it. Okay, so apology, folks, for those folks who are on the line, but I think we've got you back now on the teleconference line. And I'm not sure whether you're still muted or whether you've come off mute at this point. So, Marisol and Peter and Joellen, are you able to still hear us?
Yes. Yes.
Hopefully, hopefully the folks on the line can still hear us, but I'll just proceed to the next question. The next question coming in about the data cubes. So, Peter, what types of data are contained in those data cubes? And there's also someone who had a little bit of an issue with accessing them. They got a message about PowerPlay Studio not launching.
Yes, I should have mentioned that at the beginning. One of the things with the data cubes is the browsers that work with the data cubes are the Microsoft Internet Explorer and Firefox. Unfortunately, right now the Google Chrome browser doesn't work with the data cubes, and that's when you see that message. It also doesn't work currently with a lot of the tablet and cell phone browsers unless you download the Firefox version for tablets and that sort of thing. As far as the data that's in the cubes, it's quite a variety of data. As I mentioned before, it's morbidity data, cancer incidence data. There's mortality data in there. A lot of risk factor data coming from primarily the Canadian Community Health Survey. The CCDSS data is in there that Joellen was talking about. There's some population determinant type data in there, and I think we have some census data in there as well. It's quite there's probably at least 100 or more data cubes available, and you can either kind of go into the different folders that are fairly descriptive about what they contain, or like I was showing earlier, you can also type in the little search box at the top if you want to look for a particular piece of health content. One of the folders is actually disease specific, so, and I believe it's near the top of the menu. So, for example, if you want to look for diabetes data, you just go in there under disease specific data, and then you'll see a folder that's for diabetes information, and pretty much all the chronic diseases have their own folders in there. So it's a different way of finding the same kind of data, but it's quite a variety actually.
I just wanted to add that the info-based chronic disease indicator framework is accessible through Google Chrome, probably because this tool is not as interactive as the Cube.
Yeah.
And you also can access it through mobile devices.
Yeah.
Great, thanks. So a question for you, Marisol. On the indicator framework, what are the agency's future plans to ensure the framework remains updated and at the same time supports ongoing consistent reporting?
The framework was developed keeping in mind that it will be a somewhat evergreen product. We're committed to keep most measures stable so people can follow them and look for patterns. But based on priorities, based on new data that is more accurate or better, different work will be revised before every update to ensure that it still remains addressing the priorities for public health and the health of Canadians, and also uses the most updated and quality data to report on its measures.
And back to you, Joellen. Question about who uses the CCDSS data and how does it help them in their work? So maybe some case study examples.
Yes. So we have many uses of the CCSS data. One is to inform the Minister of Health, Rona, to tell her to speak about the burden of diseases in Parliament, at Parliament meetings. Another is to actually inform policy makers, both at the federal and provincial level, on the number of hospital beds or the number of people who are affected in their communities with chronic disease. Also, these data are used to, like, for example, by disease associations like the Canadian Diabetes Association or Hypertension Canada to inform on guidelines for clinical guidance in the physician office or hospital. So those are some examples of how these data are used.
Great, thanks, Joellen. So I don't see any more questions coming in. Now's your chance. There's still a few minutes left for the speakers to respond to questions. So please send them in via the text chat if you have any. Also, I just wanted to note that there's an email on the screen and on the final slide here for InfoBase. So if you do have any questions or comments after the webinar that you think of, please do email that email, and they'll respond from there. And also wanted to cue you to our survey. So we've got the link on the screen and also just submitted in the text chat feature. So if you're able to take just a few minutes to fill out that survey, it's really, really helpful for us in terms of continuing to improve on these webinars and make sure they're a value add for attendees. Okay, so we still have a few minutes left. We can wrap up early, but maybe if any of the speakers had any comments or maybe could provide some examples of either sort of, again, kind of case study examples, either internally or at the provinces and territories or externally of how these tools have been used or are being used.
Well, I will briefly start with the chronic disease indicator framework, and as I mentioned, it's a very young product. It's being available externally just for a few months, and within PHAC for a year. And it has informed many of our responses to not just nationally, but also internationally with the UN, the WHO, as well as within Canada as well. And I will also, before I let Joellen and Peter also respond to this, I wanted to encourage everyone to please share these products with your networks. Our whole purpose of working and producing all this information is so information is used for action, and it can't happen unless people know about the products. So please do share with your network and tell us about what you think about these products and how could they improve, or if you have questions. Thank you.
Yeah, and actually I just want to pick up on that comment by Marisol that ultimately these tools are built for you guys and to serve your needs, so we are always open to suggestions for improvements and ideas of the sorts of things you'd like to see. So don't be afraid to use the email that's on the screen now if you have any suggestions or comments.
Yes, this is Joellen. Just an example of how these data are used at the provincial level. In New Brunswick, they've started actual disease profiles where they use the data off the CCSS data from the cubes and the framework, I believe, to develop what they call physician profiles. So they actually kind of do a fact sheet of the actual patients that the physician sees in his or her office, and feed that back to the physician so they know more about the statistics or demographics of their own patients. So I thought that was a creative, innovative use of these type of data. And I'm echoing what Marisol and Peter said, but even surveillance systems need tweaking and building and suggestions. And we also would like to hear if you yourself or you're involved in a team in building another surveillance system, because lessons learned are great to share ideas and troubleshooting ideas of how to work through issues and problems. And if you need any support or documentation on the CCDSS, please email us. Let us know.
Thanks very much. That's a great point, actually, that I know we still got a few people on the line, but it's a great point that if you are interested in getting support, that's another avenue in terms of how to use these tools. And so that's great to hear, Joelle, and that there's support at the agency to use these. There is one question that came in from Caroline, and the question is, has there been any interest in adding environmental factors such as air quality to these data sets? Or is that already there?
Environmental factors is one of our data gaps. We have been working in the last year on upstream factors for chronic disease prevention. And certainly it is an area that we deem very important to support our government actions to chronic disease prevention, and it's under our radar. So we are always looking for connections, and if you email us, there is a group within our division that is working in this area, and currently, as you see, there's not a specific measure within the framework yet. It is a gap, but we are working on it, and if you're interested in it, do email us, and I will connect you with our lead on our division, who will tell you more detail on where we are at on this area.
Great, thanks, Marisol. So we have a few minutes left. I just want to maybe start to wrap up at this point. And again, wanted to thank very much Marisol, Peter, and Joellen for your wonderful presentations. And I wanted to thank as well all of our attendees for joining in and engaging and sending their questions, and even a few engaging on Twitter and sending out the word on Twitter about using that indicator framework hashtag. So that's great. And a reminder again that we'll be sending out the recorded webinar. We're going to send out a link to the webinar, but you can also paste it from your text chat here, and we really appreciate if you're able to provide feedback. And want to wish all of you a great rest of your days.